In this video, we will study about sex hormone and their antagonists. There are three sex hormones, like one is androgen, then estrogen and progesterone. And in this video, we will discuss about androgens and anti-androgens. Testosterone is the main androgen in male, and it is synthesized in Leydig cell, that is interstitial cell, under the influence of interstitial cell stimulating hormone of anterior pituitary, and FSH is responsible for spermatogenesis. Now the action of the natural androgen is, they have two action. One is androgenic action and second one is anabolic action. Testosterone and dihydrotestosterone are responsible for the development of secondary sexual characters and sex organ in male, and they cause maturation of the reproductive organs. Second action is of androgen is that they has anabolic action. They enhances the muscle mass, causes increased protein synthesis and maintain the positive nitrogen balance. They also promote the erythropoiesis. Now coming to the classification of androgens, they are divided into natural androgens and synthetic androgens. Natural androgens include testosterone, dihydrotestosterone and androstenedione, and the synthetic androgens are again classified into having mainly and exclusively androgenic action, and one are anabolic steroid that has major anabolic action and lesser androgenic action. The synthetic androgens include methyl testosterone and fluoxymestrone. They are given orally and they are slowly metabolized. And third is esters of testosterone. And the anabolic steroids, which are having greater anabolic action and lesser androgenic action, includes methanedione. It is given by oral or intramuscular route. Next is nandrolone phenylpropionate, given by intramuscular route. Then nandrolone deconate, given by IM route. Then stenozole zolol, that is given by oral route, and oxandrolone, that is given by oral route. Next is where the therapeutic uses of androgens. Androgens are used in replacement therapy in males with hypogonadism due to testicular failure and hypopituitarism. Transdermal and parenteral preparation of testosterone and dihydrotestosterone are commonly used as they maintain the serum testosterone level within the normal range. As androgens have uh, anabolic action and they increases the muscle mass and protein synthesis, so they are used in HIV patient to increase their muscle mass and strength. Next use of androgens are, they are used in senile osteoporosis. Next, coming to the adverse effect caused by androgens. If androgens are given to female, they caused virilization, means they causes the hirsutism, menstrual irregularity, acne and breast atrophy in female. And when they are given to children, they cause premature closure of the epiphysis and cause the impairment of growth. Androgen also causes the sodium and water retention, so they cause edema, and they also causes cholestatic jaundice. Now the contraindication and precautions of use of androgens. Uh, in pregnancy, androgens are contraindicated because there is a fear of virilization of the female fetus, and they also causes risk of increased carcinoma of prostate and breast cancer in man. As they cause the sodium and water retention, so they are also contraindicated in renal and cardiac disease. Now coming to the anabolic steroids. Anabolic steroids promote protein synthesis and increase muscle mass, resulting in weight gain. Testosterone has potent anabolic action, but it cannot be used because of its strong androgenic action. So, in that, where we have to use testosterone, now the anabolic steroids are used in some cases, like in treatment of the chronic illness to improve the appetite and feeling of well-being, during recovery from prolonged illness like surgery, burns, trauma, or chronic debilitating disease, and in senile osteoporosis. Now the adverse effect and contraindication of anabolic steroids. They uh, their adverse effect are same as the testosterone, and sometimes these anabolic steroids are abused by athletes to increase muscle mass strength, so the anabolic steroids are included in the dope test of athletes. So next are Antiandrogens. Antiandrogens are classified into physiological antagonist, testosterone synthesis inhibitor, androgen receptor antagonist, and 5-alpha reductase inhibitor. Physiological antagonists include estrogen. Estrogen inhibit the gonadotropin releasing hormone, which lead to the inhibition of the luteinizing hormone and release of follicle stimulating hormone, so there will be no secretion of testosterone, and they act as an physiological anti-androgenic drugs. Next group is testosterone synthesis inhibitor. It includes ketoconazole. It is an antifungal drug and it inhibits the adrenal and gonadal steroid synthesis by inhibiting the CYP450 enzyme. Next group include androgen receptor antagonist, means they directly inhibit the androgen receptor. The drug under it are flutamide, biglutamide, and cyproterone. They block the androgen receptor, so they are used in treatment of carcinoma prostate. So there will be less secretion of the androgen from prostate and decreases its size. Next, in the treatment of hirsutism in female, and for the treatment of acne in both male and female. Adverse effect of androgen receptor antagonist include either they cause impotence, hot flushes in female, gynecomastia in male, and decrease and inhibit the synthesis of spermatogenesis. Next group of anti-androgen drugs are 5-alpha reductase inhibitor. The drugs in it are finasteride and dutasteride. Normally, the testosterone is converted into dihydrotestosterone. Dihydrotestosterone is the active form of testosterone, and 5-alpha reductase causes the conversion of testosterone into dihydrotestosterone. So the finasteride and dutasteride will block the enzyme 5-alpha reductase, so that there will be no formation of the active form of testosterone. 5-alpha reductase inhibitor are used in the treatment of benign prostate hyperplasia. They cause the decreased size of prostate and improve the urinary flow, or we can say that it inhibit the dynamic and static component of the BPH. They are also used in the treatment of male pattern baldness. Side effect of the 5-alpha reductase are they cause impotence, itching, and causes decreased libido.